Everyone. Today we will study the larynx and trachea, laryngeal position and relationships. The larynx is primarily composed of laryngeal cartilages and laryngeal muscles. It serves both as an airway for respiration and as an organ for phonation. Its superior boundary is the upper border of the epiglottis, and its inferior boundary is the lower border of the cricoid cartilage. It communicates with the laryngopharynx via the laryngeal aperture and connects to the trachea via the cricotracheal ligament. In adults, the larynx lies anterior to the 3rd to 6th cervical vertebrae. Anterior to the larynx are the skin, cervical fascia, and infrahyoid muscles, arranged in layers from superficial to deep. Posteriorly lies the pharynx. Laterally are the cervical vessels, nerves, and the lateral lobes of the thyroid gland. Laryngeal cartilages form the framework of the larynx, consisting of the thyroid cartilage, cricoid cartilage, epiglottic cartilage, and the paired arytenoid cartilages, among others. Thyroid cartilage. The thyroid cartilage forms the anterior and lateral walls of the larynx. It is composed of left and right quadrilateral laminae that fuse anteriorly at the median line. The site of fusion is called the laryngeal prominence, which protrudes forward and is commonly known as the Adam's apple. This is more prominent in adult males. Above the laryngeal prominence is a V-shaped notch, called the superior thyroid notch. The posterior borders of the laminae are free and project anteriorly and inferiorly into processes, called the superior and inferior cornua. The superior cornu is longer, connecting to the greater horn of the hyoid bone via ligaments. The inferior cornu is shorter, articulating with the cricoid cartilage. 2. Cricoid cartilage. The cricoid cartilage is located below the thyroid cartilage. It is the only complete cartilaginous ring in the larynx. It consists of a narrow anterior arch and a broad posterior lamina. The superior border of the lamina has articular facets for the arytenoid cartilages on both sides. The cricoid arch is level with the 6th cervical vertebra. At the junction of the arch and lamina is a thyroid articular surface. The cricoid cartilage plays a vital role in supporting the airway and maintaining its patency. Damage to it can cause laryngeal stenosis. 3. Epiglottic cartilage. Located posterior to the body of the hyoid bone, broad above and narrow below. Leaf-shaped, its inferior end is attached via the thyroepiglottic ligament to the thyroid cartilage angle. Its upper anterior surface is covered by mucosa, forming the epiglottis. It acts as a valve for the laryngeal inlet. During swallowing, the larynx elevates with the pharynx and moves forward. The epiglottis covers the laryngeal inlet, preventing food from entering the larynx and guiding it into the esophagus. 4. Arytenoid cartilages. The arytenoid cartilages are paired. They sit on the superior border of the cricoid lamina. Each has an apex, a base, 2 processes, and 3 surfaces. The process projecting anteriorly from the base is called the vocal process, providing attachment for the vocal ligament. The process projecting laterally is called the muscular process, which serves as attachment for most laryngeal muscles. Laryngeal cavity. The laryngeal cavity is a space enclosed by laryngeal cartilages, ligaments, fibrous membranes, laryngeal muscles, and laryngeal mucosa. It extends superiorly from the laryngeal inlet, communicating with the pharyngeal cavity, and inferiorly connect the trachea, communicating with the lungs. The lateral walls of the laryngeal cavity have 2 pairs of mucosal folds. The upper pair are called the vestibular fold, and the lower pair are called the vocal folds. These 2 folds divide the laryngeal cavity into the laryngeal vestibule above the vestibular folds. the infraglottic cavity below the vocal folds, and the intermediate laryngeal cavity between the vestibular and vocal folds. Laryngeal inlet. The laryngeal inlet is the superior opening of the laryngeal cavity. It is bounded by the upper border of the epiglottis, the aryepiglottic folds, and the interarytenoid notch. The mucosal folds connecting the arytenoid cartilages to the lateral margins of the epiglottic cartilage are called the aryepiglottic folds. The vestibular folds attach to the posterior surface of the thyroid cartilage angle and to the anteromedial border above the vocal process of the arytenoid cartilage. They are sagittally oriented, pinkish mucosal folds. The slit between the two vestibular folds is called the rima vestibuli, which is wider than the rima glottis. The vocal folds stretch between the posterior surface of the thyroid cartilage angle and the vocal process of the arytenoid cartilage. They project further into the laryngeal cavity than the vestibular folds. 2. Laryngeal vestibule. The laryngeal vestibule lies between the laryngeal inlet and the vestibular fold. It is funnel-shaped, wide above and narrow below. The middle and lower parts of its anterior wall have the stalk of the epiglottic cartilage attached. A nodular elevation above the attachment site is called the epiglottic tubercle. 3. Intermediate laryngeal cavity. The intermediate laryngeal cavity is the portion between the vocal folds and vestibular folds within the laryngeal cavity. Laterally, it extends through the slit between the vestibular and vocal folds into the laryngeal ventricles. The vocal cords are composed of the vocal ligament, vocalis muscle, and laryngeal mucosa. The rima glottis is the slit between the two vocal folds and the bases and vocal processes of the arytenoid cartilages. It is longer and narrower than the rima vestibuli and is the narrowest part of the laryngeal cavity. The anterior two-thirds, between the vocal folds, is called the intermembranous part. The posterior one-third, between the bases and vocal processes of the arytenoid cartilages, is called the intercartilaginous part. The vocal folds and the rima glottis are collectively termed the glottis. 4. Infraglottic cavity. The infraglottic cavity is the space between the vocal fold and the lower border of the cricoid cartilage. This is the infraglottic cavity. Its submucosal tissue is loose. Inflammation can easily lead to laryngeal edema, especially in infants and young children, who are more prone to acute laryngeal edema, which can cause laryngeal obstruction, leading to difficulty breathing. Trachea. Position. The trachea is located between the larynx and the bifurcation of the trachea. The average length in adult males is 10.31 centimeters, and in females it is 9.71 centimeters. The trachea begins at the lower border of the cricoid cartilage, approximately level with the lower border of the sixth cervical vertebra. It descends to the level of the sternal angle, approximately level with the lower border of the fourth thoracic vertebra. Here it bifurcates into the left and right main bronchi. The entire length of the trachea is divided by the superior thoracic aperture into cervical and thoracic part. On the internal surface of the carina, there is a sagittal, upward projecting crescent-shaped ridge, called the carina of the trachea. It is slightly deviated to the left. It is an important landmark during bronchoscopy for identifying the tracheal bifurcation. 2. Trachea. It is composed of tracheal cartilages, smooth muscle, and connective tissue. The tracheal cartilages consist of 14 to 17 C-shaped hyaline cartilage rings, with the gap facing posteriorly. The gap in the cartilage rings is closed by the membranous wall of the trachea, which is formed by elastic fibers and smooth muscle, the trachealis muscle. 3. Isthmus of the thyroid gland. It is usually located anterior to the second to fourth tracheal cartilage rings. Tracheotomy is often performed at the level of the third to fifth tracheal cartilage rings. Bronchi are the branches arising from the bifurcation of the trachea. The first level branches are the left and right main bronchi. Right main bronchus. The average length in males is 2.1 centimeters, and in females it is 1.9 centimeters. Its external diameter averages 1.5 centimeters in males and 1.4 centimeters in females. The angle between the tracheal midline and the inferior border of the main bronchus is called the subcarinal angle. The right subcarinal angle averages 21.96 degrees in males and 24.7 degrees in females. 2. Left main bronchus. The average length in males is 4.8 centimeters, and in females it is 4.5 centimeters. Its external diameter averages 1.4 centimeters in male and 1.3 centimeters in females. The left subcarinal angle averages 36.4 degrees in males and 39.3 degrees in females. The differences between the left and right main bronchi are: the former is slender and long, with a larger subcarinal angle, obliquely oriented, and usually has 7 to 8 cartilage rings. The latter is short and wide, with a smaller subcarinal angle, relatively straight and coarse, and usually has 3 to 4 cartilage rings. Foreign objects aspirated through the trachea often enter the right main bronchus.